to the old school, cause I'm an old fool who's so cool. If you wanna get down, I'ma show you the way. There it is, let me hear you say. Woo.
I was here from 1993 until 2000, and I was at that time an assistant hospital administrator, and all of regulatory compliance reported to me, infection control, as well as trauma and Joint Commission, DHH. Anything that dealt with regulatory compliance was also my responsibility. And then in January of 2000, that's when Dr. Clay, Dr. McDonald, and Mr. Machota asked me if I would take on graduate medical education. I was the institutional coordinator, and the institution was in a little bit of trouble, and it was my job to get them out of trouble, and we did. So I would say the greatest challenge was addressing that and getting us totally compliant, and then preparing us for our 2010 on-site survey, which we had. I'm really happy, and it's because of our medical staff and the dedicated program directors that we have today that we have not had a citation since 2000. Everybody knows Dr. McDonald smoked a pipe, and I was called to his office again, and I went in. And before that, we had become a no smoking facility, period. And he looked at me, and when I went in, and he loaded his pipe, and he said, "Are you going to tell on me, Lisa?" And I said, "Who would I tell, Dr. McDonald? You're the boss." And he just kind of laughed and continued to smoke his pipe. I feel honored and privileged to have worked at LSU for 30 years. When I first came, I didn't plan to be here for 30 years. I wanted to get my master's and then move, and it's like I blinked my eyes and it was 30 years later. So I would like to thank those that I've worked with in 30 years, how much they have contributed to the happiness in my life, and I hope that I, in exchange, have done something for them as well.
Yeah, way down yonder on the Chattahoochee, never knew how much that muddy water meant to me. But I learned how to swim, and I learned who I was, a lot about living and a little about love.
My story actually begins 40 years ago. In 1983, I started here as a medical student and was taught by people like Joe Penny in anatomy, Dr. Deshay, legendary, Dr. Clausen, Dr. Beal, Scott Kennedy in biochemistry, Warren Grafton in pathology, Dennis O'Callahan. I had to leave in 1987 to pursue emergency medicine training because we didn't have that here. And toward the end of my residency in Louisville, Kentucky, Dr. Darrell Williams, who was the dean at the time, knew that I was doing emergency medicine, and he called me and said, "Tom, I want to try to fix emergency medicine here at LSU. Would you be interested in coming back?" At the time, there was a medical emergency room that was run by the Department of Medicine, a surgical emergency room run by the Department of Surgery, and a triage nurse in the middle. And she decided which side you went to get medical treatment or surgical treatment. Luckily, there were a few other kindred spirits here at the time. Donna Cardin was here, and Jim Small was here. And we together were able to develop a freestanding division of emergency medicine. And then later, under the leadership of Dr. John McDonald, our first chancellor, in the early 2000s, we were able to start a residency training program in emergency medicine that we started in 2004, and I'm very proud to say it continues to this day. When I was a medical student, the K-Wing had just been completed. Since then, there's the Biomedical Research Facility, the ACC across the street. We did a complete remodel and expansion of the emergency department that was finished in 2010. Yeah, it just seemed to have exploded under Dr. McDonald's tenure, and now we're about to open our new education building, another exciting chapter in the life of this place.
Oh, baby, baby, the reason I breathe is you. Boy, you got me flying. Oh, baby, there's nothing that I wouldn't do.
Been here a long time. I was a student worker in payroll, and I worked there back when the former person was there. That was before Ms. Mason came to work here. And then I became a full-time employee in the bursar's office, and I spent 20 years in the bursar's office before I left to go to general accounting, and now I'm actually back in the bursar's office again. In March of 1993, when I came here as a student worker, they were still working on the completion of it. They were finishing some of the exterior. There was no cancer center when I came to work here. The Allied Health building had not been built yet. The big clinic down on the corner, the ACC Women's Health, that did not exist. That was a parking lot. I can remember parking there and walking over years ago. The bursar's office was nicknamed the Cage by students years ago because of the door that draws across there, and it looks like a cage. And so we called our Girls Night Out group the Cage Crew. And that's basically how everybody met. It was different people from different departments, and we would get together. And we've had a lot of fun through the years. Probably been louder than we should have been down there at different times. And of course, we had louder equipment. Nowadays, we have technology where you're scanning checks to the bank. You're not physically taking checks to the bank. And back then, we had that noisy encoder that you had to 10 key the numbers into, and it would encode the bottom of those checks. It was loud. So we were a loud group down there. Dr. Murphy used to be across the hall from us, and there's been many a time where she's had to shut her door to be able to work just because of the noise level in the hall. So now that the Vice Chancellor Suite is next to us, I'm glad we're not that noisy anymore.
Baby, the reason I breathe is you.